What impacts the accuracy of GERD diagnostic tests? Imagine trying to find a small leak in a pipe. Sometimes the leak is obvious, but other times it's hidden or only shows up under certain conditions. The same idea applies when diagnosing gastroesophageal reflux disease. The tests used to find it can be affected by many factors, making the results more or less reliable. First, the type of test used plays a big role. Some tests, like esophageal pH monitoring, measure how much acid is in the esophagus over 24 hours. These tend to be quite accurate. Endoscopy, which looks inside the esophagus with a small camera, can show damage or inflammation. But if the esophagus looks normal, it doesn't always mean GERD isn't present. Symptom questionnaires and response to acid-suppressing medicines can also help, but they are less precise because symptoms can overlap with other conditions. Next, patient characteristics can influence test results. For example, people with mild symptoms or those who respond well to medications might not need extensive testing. But if someone has unusual symptoms or no visible damage on endoscopy, more detailed tests like pH monitoring are often needed. Factors such as body weight, diet, and esophageal muscle function can also affect how well a test reflects the true situation. For instance, eating spicy or fatty foods before a test might increase reflux episodes, skewing the results. Timing is another important factor. If a test is done when symptoms are not active, it might miss reflux episodes. For example, if a person is tested during a symptom-free period, the results could underestimate reflux activity. Conversely, doing a test during or immediately after a meal might show more reflux than usual. The way the test is performed, like how well the probes are placed or how strictly instructions are followed, also impacts accuracy. Proper placement of pH probes in the esophagus is essential for correct readings. Interpretation of test results depends on the experience of the clinician and the standards used. Different doctors might have slightly different thresholds for what they consider abnormal acid exposure. Some newer tests, like impedance monitoring that detects non-acid reflux, are promising but still being studied for routine use. Finally, combining multiple tests and considering the patient's overall health and symptoms provides the clearest picture. No single test can always give a complete answer. Using symptom diaries, endoscopy findings, and pH or impedance results together helps doctors make better decisions. Understanding what affects test accuracy helps people living with GERD know what to expect and how their results are interpreted. It's important to remember that test results are just one part of the bigger picture, and your healthcare team considers all factors to guide your treatment. Being aware of these influences can help you work with your doctor to manage your condition effectively and stay informed about your long-term health.